Imagine this. You're sitting by your phone, checking it obsessively every few minutes. Heart races, and each time it buzzes, you're hoping it's the doctor's office with your test results. Turn into days, and the anxiety builds, affecting your sleep, your concentration, even your physical health. Sound familiar? One of the scariest, most stressful things people experience in regards to their health, waiting for a lab or imaging results. You don't know if the news you receive will completely change your life or not. That waiting period is unnerving. Most of us will experience this stress at some point in our lives, or will know someone who has. If you are new here and you've landed on this episode, welcome. I'm Dr. Bayo, your health advocate, a practicing family medicine physician in Northern Nevada, and bring what I see in the clinic into the work I do on the news, on social media, when I travel around the country speaking, and to this podcast. I typically invite on experts from all different areas to help you understand your body and healthcare system. But today, I'm breaking down something I see and hear a lot to help you advocate for yourself. That's why today's episode is so important. I'm diving into why this happens and what you can do to help take control during these situations. Healthcare usually happens beyond clinical walls, something I've been thinking about lately. Despite all of our technological advancements, patient portals, electronic medical records, sophisticated tests and equipment, the healthcare system often isn't set up with a patient focus. Have all of this amazing technology, but if you're not getting your results, or if you can't understand what they mean, that matters to you as the patient. Real stories, real anxiety. Let me start with a story about a recent encounter I had with someone who I'll call Lisa. His husband was diagnosed with brain cancer 3 years ago. Gone through multiple treatments, including chemotherapy and radiation, which are common treatments used to treat cancer. Months ago, he received the news so many cancer patients dream of hearing. Cancer was in remission. Cancer was no longer detected. It was great news, and they were elated. But for those who have experienced cancer up close, remission is not the end of a cancer patient's journey. There's always a risk that the cancer will come back. His husband was placed on a monitoring plan involving CT scans every 3 months. Her scan was done 4 days ago, and she hasn't received the results despite calling her husband's doctor multiple times. Like many, he works Monday through Friday from 8 to 6 and can't go to the clinic in person to ask for the results. He keeps calling and leaving voicemails and is now feeling bad that she might be bugging her doctor. I talked to her. She actually said, I want to be annoying. And I'm really a patient person. I know the clinic is busy, but the fact of the matter is, Lisa is experiencing major anxiety. Her heart is racing, she's having difficulty concentrating, and feeling on edge, waiting for the results. She's waiting to find out the status of her husband's CT scan is having serious impacts on Lisa's health. Unfortunately, this story plays out far too often. Think of how stressful it can be to wait on test results for something more commonplace, like cholesterol or blood sugar levels. When it's a test for something more serious or even life-threatening, stress level goes through the roof. Consider another patient I had come in a while back. We'll call him Larry. Larry had received blood test results and reviewed them in his patient portal. He didn't know how to interpret them. He actually decided to come see me in the urgent care to help interpret what the lab results said. It took an entire week for someone from his established healthcare team to explain what the results meant and how they would impact him. The truth is, in many cases, our current healthcare system is not set up with a patient focus, despite all of the advancements and technology available. A reality check. The system is broken, and we have to find a way to navigate the system that we currently have. What do? For those who follow me and have heard my talks, I normally advise my patients to start with the 3 C's: clear, concise, and confident. Simple yet powerful framework helps ensure that your concerns are heard, understood, and taken seriously. 3 C's framework: clear. Explain your needs simply, why it matters. Just like doctors need clear information about symptoms to make an accurate diagnosis, also need clear communication about your expectations for receiving and understanding test results. Clear about your expectations from your doctor. Set up a specific timeline for when you should expect results and ask, how will they be delivered? By phone, through the portal, or at a follow-up appointment? Explain how these results are making you feel. Very nervous about these test results and how will it impact my future? Directly about the timeline. Can I expect to hear about my results and how will they be communicated to me? Directly about what these results will mean. The results of this test, what action will we take if it's good news? What action will we take if it's not good news? Remember, being clear isn't about being demanding. It's about removing ambiguity so everyone understands what you need and has clear expectations. Guys, stick to the main points. You only have about 15 minutes with your doctor, so keep the conversation focused and on topic. Confident. Your own chief medical officer. Let's talk about confidence. Patients report feeling dismissed by doctors, and even more common is this feeling of a power dynamic. Doctor seems all-knowing, and you somehow feel small, uninformed. Here's the thing. You can be the smartest, most educated person in any other room and still experience this unsettling phenomenon in the doctor's office. Confident ensures you show up as your best self, navigate your appointment with ease. You need to remember something important. You've lived in your body your whole life. You know when something feels off. You might be the medical expert, but you are the expert on your lived experience. Think of it this way. You had a great ally ordering tests for you, anxious to get those results and understand what they might mean for your life going forward. Changes that might be needed, any adjustments to your routine will affect you directly. Be confident when you show up in that exam room because you absolutely deserve to be there. I can't tell you how many times they've told me they feel like they're wasting their doctor's time. To be clear, you are not wasting anyone's time. You approach your healthcare using the 3 C's. Yes, your doctor has many years of education about human biology and medicine. That expertise is valuable, but you've lived in your body your whole life, and this is your health we're talking about. Healthcare happens when confident patients and knowledgeable doctors work together as a team. A partnership is how you get the care you truly deserve. What does it look like to actually put these 3 C's into play when you're facing a big test or screening? Break it down into 3 simple steps. First, clear about your expectations with your doctor. This means having a direct conversation about when you should expect to receive your results. Be in 3 days, possibly a week. Specifically, how those results will be delivered to you. Will they call you directly, put them in your patient portal, or discuss them at your next follow-up appointment? This clarity upfront can save you days of anxiety. Second, concise. When setting up your follow-up plan, maybe that's arranging a quick phone call in a couple of days or scheduling an in-person appointment next week. It's also the time to ask what might prevent your doctor from contacting you with your results. Is there a backup person you can reach out to if your doctor is unexpectedly called away? A plan B can make all of the difference when you're anxiously waiting. Third, be confident in your right to understand what's happening with your health. Remember, know your body and your needs better than anyone. Don't hesitate to say things like, I understand what I can expect from here, or the next steps if these results show X or Y. Wait, you're mentally prepared for whatever comes next. If you or someone you love is navigating a health challenge that involves testing, monitoring, any appointments, I created something that might really help you. I call it the Health Playbook, and it's available for free on my website. This playbook as your personal health command center, a printable resource designed to help you become an active participant in your own healthcare journey. People who use it print it and use it to create a binder that goes with them to each medical appointment. Inside, you'll find a medication tracker where you can know not only what medications you're taking, why you started them, and how they make you feel. It can be eye-opening. Sometimes you might feel great, but other times you might notice that certain medications cause dizziness or nausea. And this information documented can be incredibly valuable during your appointments. The book also includes spaces to record every diagnosis you've received, every surgery you've had. A section for your family's medical history, which can be crucial when doctors are trying to rule out genetic conditions in or out. One of my favorite features in this resource is the doctor's appointment log. It allows you to summarize the key takeaways from each visit. This is important. It clearly outlines what you are responsible for before your next appointment and what doctor is responsible for. Accountability tool alone has been a game changer for many of my patients. I also included a section where you can prioritize what health goals matter most to you. Let's face it, everyone has the same health priorities. Respect that. You want to focus on limiting alcohol or caffeine intake, or if working out is your priority, customize the playbook to reflect what matters in your health journey. Also, daily, weekly, and monthly symptom trackers, which can be invaluable depending on what health issues you're monitoring. Included some ready-to-use questions you can ask your doctor or medical assistant at your next appointment. This entire resource is available completely free on my website, drbayo.com. That's DOCTORBAYO.com. Also find the link in our show notes. It's my gift to you because I truly believe that better organization leads, better advocacy, and more efficiency as you navigate the healthcare system, ultimately leads to better health outcomes. Also find the link in our show notes. It's my gift to you because I truly believe that better organization to better advocacy and more efficiency as you navigate the healthcare system ultimately leads better health outcomes. I've heard a lot of tips and tricks so far, but sometimes at our best efforts, we might not feel comfortable advocating for ourselves, especially when we're already anxious about test results or a million other reasons it's hard to advocate for yourself. This is when bringing another person with you to help advocate can be incredibly helpful. This person might be a family member or a friend who can make calls on your behalf, someone who can accompany you to appointments and help you ask important questions, or a person who can help you understand your test results once you receive them. Underestimate the power of having someone in your corner navigating the healthcare system. And if you aren't able to bring someone in person, doctor's office ahead of time, and get permission to have your advocate on speakerphone or FaceTime so they can be with you to the power of technology. Doctor, I've ordered thousands of tests to help uncover what's going on with my patients. No, waiting period can be incredibly hard. If you're in that space right now, please know you are not alone. I see you. I'm truly sorry you're navigating this uncertainty. Absolutely have the right to call your doctor's office to ask when you can expect your results. Clear expectations can help ease some of the stress that comes with waiting. Also schedule a follow-up appointment and ask to be added to the cancellation list so you have a chance to be seen sooner if a spot opens up. If you have access to an online patient portal, your results may show up there before your doctor reaches out. It's okay to look, but be gentle with yourself. Language can be confusing, and it's common to feel more anxious when viewing information, especially without context. Caring for yourself isn't being pushy. Powerful act of self-care. And one more tip, know the medical assistants or support staff at your doctor's office. Those relationships can make a big difference in helping you access the care and clarity you deserve. Did something in this episode click for you? Share it with someone who might need these insights too. But here's the thing. Healthcare advocacy happens beyond clinical walls. It's about understanding our bodies, knowing our resources, and helping each other navigate the healthcare system. Remember the 3 C's: clear, concise, and confident, and use them not just when waiting for test results, but in all your healthcare interactions. Health is too important to leave to chance or to an unburdened system.